Big Biz Show is on the air. 110 million broadcast homes strong, 150 radio stations. That's right, we are TV and radio at the same time. All the way coast to coast into other countries, thanks to American Forces Radio Network. Sully, Costa, and the Day Trader Quattro. Bam. Good to see you today. Hillstream Biopharma. You remember the name because they were on with us before. Randy Milby is the chairman and CEO. Really interesting company. I've been digging deep into this deal. And just to check out what these guys are doing, they are publicly traded under the stock symbol HILS. Hillstream Biopharma, HILS. Go to hillstream.com. They have created, they're targeting, I should say. They're creating, okay? They're figuring out drug-resistant cancers. God, what a horrible subject to talk about, but boy, what a bright light at the end of that tunnel. I'm just gonna let him take it from here because we had such a great interview last time. We had so many people email that we thought we'd bring him back, and we're gonna try to get him in the studio when we can. But here to talk about that is, once again, Chairman and CEO Randy Milby. Randy, how are you, sir? Great to see you again.
Thank you. Thanks for having me on again.
I appreciate it. You know, when you start talking about creating therapies targeting drug-resistant cancers, everybody's ears perk up, and that's a solid thing. So I want to talk about that. I want to talk about, you know, the company in and of itself and sort of the genesis of how you sort of are bringing this along. I'll let you take it from there, Randy, because it's a really interesting topic.
Well, I'm really excited to share the Hillstream story with everyone today, because as you said, we're tackling one of the biggest challenges in cancer treatment today, which is drug resistance. But just to put this in perspective, to show you, as Sully, you just mentioned, how important this is, I'll give you a quote from Dr. Steven Rosenberg from the National Cancer Institute, which really highlights what we're doing, because he states only 7% of patients with cancer are cured today.
See, that is astounding to me.
Surgical removals, like 93% of the patients, they relapse and they're really never cured, and they ultimately die as a result of those drug-resistant cancer cells. That's what we're going after.
And you're using a mechanism called, forgive me if I'm wrong, ferroptosis, right?
You got it.
Ferroptosis.
You're remembering your chemistry.
I remember from last time. Yeah, so talk about that, because this is novel, and this is why you guys are out front in this. Exactly.
So we're at the cutting edge on this. So just give you a little background. Cancer cells hijack iron for their uncontrolled growth. Mm-hmm. And these drug resistance, they're also called persistor cells.
Yes.
They're addicted to iron. And if you think about it, it's because they need that growth, that uncontrolled growth.
Sure.
So what ferroptosis is, what our drug does, it sops up that iron. It deprives that iron for those growing cancer cells. And without that iron, the cancer cells die. And those persistor cells, or those drug-resistant cancer cells, are highly addicted to iron.
You know, Randy, when I think about this, and you talk about 97% or 93% of cancers go uncured, and you're talking about a therapy like this, doesn't it feel like we're like one novel approach away from getting it all figured out? I mean, this is sort of that sort of highlight, what you guys are talking about. I'm not suggesting you guys are saying that, but when you talk about this, there's an aha moment. Well, why aren't we targeting the iron part of this argument? And suddenly we're one maybe solution away from dealing with the entire disease, correct?
Well, we've got a long way to go, but I think part of it is, you know, we learn more every day, Sully. And 5 to 6 years ago, there were only a couple of hundred papers written about ferroptosis, but we counted them. Over the last 2 years, there are over 10,000 papers written about this. So science keeps advancing, and you'll see that in our presentations too. We're adding not only to ferroptosis, but we're also going into the immuno-oncology space, more targeted therapies.
Well, let's talk about that, because right here, we broadcast in San Diego, and you might be listening to us overseas on American Forces Network, maybe watching us in New York City or listening to us on the radio in Dallas, Texas. But right here in San Diego, we talk about targeted immunotherapy all the time because we're a biocenter for cancer therapy here, especially in La Jolla, UCSD, and Scripps Medical. You guys are talking about tumor-targeted platforms. Talk about that, because that seems to be where this is most effective.
Exactly. So HSB 1216, as you said, works by ferroptosis. And what happens is this is given systemically. It's taken up, it's in the bloodstream and taken up by the leaky blood vasculature of the tumor. So the tumor takes this in, because remember I said it's addicted to iron, so as much blood as it can. And then once it's inside that tumor cell, It's broken down by the garbage disposal within the tumor, which is called, the scientists call it the lysosome. And it breaks down the component, releases the drug inside that cancer cell. The interesting thing about the Quatramer, our delivery technology, is one of the breakdown components actually shuts down the drug efflux pump. What is that in English? That's the way that the cancer cell wants to eject this bad actor or this cancer agent. So by a component of the Quatramer shuts that door and leaves that drug inside that cancer cell longer. So you don't have as much in the periphery, you don't have the off-target toxicity because you're leaving that cancer drug inside the cancer cell.
Randy, I got to ask you, you basically started this company back in 2017. You've been here since the very beginning. What was the big idea? I mean, what was that inception point where you thought about this? I mean, that's the most interesting part of this whole thing, because it's such a novel and fantastic idea. I'm just surprised that it wasn't focused on earlier. Talk about how you sort of went onto that journey.
So previously, I was a CEO of another publicly traded company that was focused on hemodialysis, and we had licensed this technology for my previous company out of a Dana-Farber Cancer Institute spinout. And the data was coming back positive, but we were a hemodialysis company, not an oncology company. Unfortunately, about that time is when my brother was diagnosed with multiple myeloma. So I started Hillstream to take this technology and just focus it in the oncology space.
Well, I can tell you that you guys are at the tip of the spear here. And if you take a look at that chart that talks about the arc of your FDA story, it's very promising. One last question before we get you out of here today, and we're going to start following this company very closely. And I got to talk Randy into coming to town at some point and spending a whole hour with us. What's the plan for getting it to market eventually? Is it, and I ask this of any time I talk to a biopharma company, is this where you guys are taking it straight to market, or we hope to partner with Big Pharma that takes it to market, then you guys are back to your research? What's the ideal in your mind?
Well, the ideal would be obviously to have a big partnership because they've already built the road to the market. So my ideal is keep advancing this. Data is king. In oncology, the more data we have, the stronger the position we're in. So our job right now is just to generate that data, get the IND, get it in demand, and I'm happy to have discussions with Big Pharma and other companies in this space.
Well, you're going to be our spokesperson for the time being. You just committed to it on national TV. You're not getting out of here. Thank you, Randy. I appreciate it. Randy Milby, Chairman and CEO, Hillstream Biopharma, of course, publicly traded under the stock symbol HILS. We love the company. Don't get confused. It's Hillstream Biopharma, unlike the Airstream that Mike lives on down by the river, which looks like a tin can of bean dip. Right off the roof. HILS, that's the stock symbol. I know I'm going to get a million emails about that one. Hillstream Biopharma. Sully, Costa, the Day Trader Trio, and you back in a second.